Hey there, I'm Dr. Casey Greene, PharmD and Certified Functional Medicine Practitioner and Clinical Liaison of Integrative Medicine for Revelation Pharma. Today I'm going to cover hair loss compounded support formulas. It's important to note that while I'll be covering information on disease states related to hair loss, as well as ingredients that have either FDA approval for related treatment purposes or ingredients with significant scientific evidence behind them for supporting hair health, I'm not in any way saying that any compounded support ingredient or formula in this presentation is FDA approved or indicated to treat, cure, prevent, or diagnose any disease related to hair loss. I'm simply presenting scientific evidence that practitioners can use to make their own medical judgment related to compounded and customized hair health support in their patients. So with that, today we'll cover clinical areas for support related to hair, then potential ingredients and mechanisms of action that you can use either alone or in combinations for various hair conditions, side effects and precautions of those, what compounded forms to use, whether foam, spray, or other formulations, what tends to work best or be most popular, key takeaways for administration, then basic testing and monitoring parameters, potential drug interactions, and popular clinical protocols. So what is alopecia? Alopecia is the umbrella or big overall term for hair loss, and it includes androgenic alopecia, which can be male or female, which is the most common, then alopecia areata, which is the next most common, and then others such as telogen effluvium, cicatricial alopecia, and tinea capitis. So androgenic alopecia, again, is by far the most common type of hair loss, followed by alopecia areata. We'll primarily cover supportive compounded measures for those two, but the remaining three can be supported by many of these mechanisms as well. Telogen effluvium is where an abnormally large percentage of hairs enter the telogen or resting phase at the same time, which causes a rapid onset of thinning hair. It's often temporary and can be caused by issues such as psoriasis or seborrheic dermatitis. So oftentimes treating those is more the specific way to address that. Then there's cicatricial alopecia. It's an irreversible form of alopecia due to scarring involved after an inflammatory process. There are various causes, including some autoimmune reactions, deep burns, radiation dermatitis, some skin cancers, and some types of infections. Then tinea capitis involves a fungal infection causing the hair to break off, leaving a black dot effect on the scalp. And topical agents rarely offer much support here, and antifungal options are often required. There are also many other potential reasons for hair loss, including hypo or hyperthyroid, as well as conditions around stress and adrenal health that might need to be individually addressed. So clinical areas for support. Male pattern or androgenic alopecia is by far the most common in the population, and it's androgen dependent, so it's often hereditary and is based on 5-alpha reductase enzyme. So what that enzyme does is it converts testosterone to dihydrotestosterone, which we'll refer to as DHT from here on out. So that causes hair follicle miniaturization and shortened growth phase in the hair cycle. So it causes several mechanisms that basically weaken the hair follicle more and more over time, which can become, the further this progresses, the more likely it can become permanent if the hair follicles completely die. So, but that's the mechanism by 5-alpha reductase enzyme converting testosterone to DHT, which is a necessary process, and you do need, males especially need DHT in the body for sexual function. It also aids in musculoskeletal health, for example. So it is important, but notably in the hair follicles, it can have this type of toxicity. So that's an area that we can look at to potentially control. Then there's female pattern, which is also androgenic alopecia. And it's actually often normal androgen levels, but these women tend to have higher 5-alpha reductase levels. And on top of that, they might have more androgen receptors to uptake the DHT, as well as lower cytochrome P450 enzymes, which would normally help metabolize the testosterone into estrogen. So basically more testosterone is left over instead of being converted to estrogen, which can result in even more DHT. So again, not generally more circulating androgens being created, but all these other mechanisms preventing it from being as cleared out or metabolized as well as more androgen receptors that can tend to cause some females, unfortunately, to have this type of hair loss pattern. Then there's alopecia areata, which is where the immune system attacks hair follicles, causing hair loss. And there's three primary types. There's patchy, which is like coin-sized patches of hair that will fall out. Then there's totalis, which is all or most of the hair on the scalp. And then there's universalis, which is all the scalp and body hair across the entire body can basically be attacked by the immune system, causing all the hair follicles to die. So that's a different area that might require different mechanisms or ways to address. And so now we'll look at support mechanisms. So we want to use ingredients that are supportive of the mechanism or mechanisms involved in hair loss if we know or suspect what they are. So starting out, we'll look at finasteride. So its mechanism of action is 5-alpha reductase inhibitor, and as we just discussed with the androgenic causes, 5-alpha reductase is what converts testosterone to DHT, which is the more toxic version of testosterone on the hair follicles. So its mechanism of action is to inhibit that enzyme that causes that conversion. Common side effects in men, although not very, very common, definitely less than 5%, if not less than 3%, depending on the study or what you look at, but decreased libido and erectile dysfunction. If those occur, either finasteride could be stopped or dose could be reduced. Sometimes it's but topically it might be less likely to cause the types of side effects versus given systemically. Precautions with hepatic impairment, and especially use in women of childbearing age, because finasteride is pregnancy category X and potentially teratogenic, so not to be used in women that are or may become pregnant. So for that reason, finasteride will not be in the majority of female-based combinations. Then we've got minoxidil, very, very popular and commonly known ingredient for supporting hair health. Mechanism of action, there's actually many, vasodilation being one of the primary, dermal cell stimulation, KATP, channel opening, and several other proposed mechanisms, making minoxidil a very powerful option. So side effects that are potential, but not very common with topical formulations, are hypotension, headache, or hypertrichosis. So again, minoxidil, many potential mechanisms to support hair growth. Not all of them are fully understood. But it should be noted that minoxidil is associated with extra shedding of the telogen phase hair during the first 6 weeks, which can actually make hair appear thinner at weeks 4 to 6. But it's important to let patients know that this resolves quickly, though, as the anagen or growth phase of hair is increased and begins to kick in. And it normally does take about 4 months to see that additional hair growth visibly coming in, just because it takes so long for hair to grow and for the hair cycles to run through. So overall, minoxidil is a very well proven ingredient to support hair growth, possibly more than anything else on the market. And looking at hypertrichosis, that's basically excessive hair growth. It is rare if applied as directed to the specified areas where we're wanting hair growth, but can happen rarely due to systemic absorption and distribution of minoxidil. And minoxidil has many more serious cardiac precautions, but all of those are related to systemic use versus via, for example, the oral or IV forms. The topical form has been proven very safe for most individuals, as proven by its over-the-counter availability. And I will note that taking aspirin with minoxidil may diminish minoxidil's effectiveness via aspirin's inhibitory effect on sulfotransferase enzymes in hair. And then minoxidil is pregnancy category C, so generally not recommended during pregnancy as a best case precaution. Then we've got retinoic acid, so active metabolite of vitamin A. It's also called tretinoin, and so it's the active metabolite of over-the-counter available retinol. So retinoic acid is stronger though and available only by prescription. So all these different names, they're all names of retinoids or various forms of vitamin A, which can get confusing. But again, retinoic acid and tretinoin are the same thing and are prescription only. So retinoic acid has notably increases minoxidil absorption, which actually makes for a very good supportive synergy when combining those two into formulations. Higher doses of retinoic acid can cause significant skin sensitivity, so you just have to be very careful with sun exposure as any new dose is tested. And the mechanism of action is cellular differentiation and proliferation, so kind of that whole vitamin A mechanism of skin turnover and improving health that way. So, and based on that, the most common side effects will be that skin sensitivity. So, avoiding too much sun exposure, using sunscreen is definitely recommended. So, contraindications, even though retinoic acid is pregnancy category C, this is largely due to very strong evidence of teratogenicity from synthetic retinoids such as isotretinoin, also known as Accutane, which is a very powerful acne medication. Caution is recommended based on the evidence with that with all retinoids or vitamin A compounds before, during, and after pregnancy. So while other retinoids aren't likely as dangerous as isotretinoin and are even part of a normal diet in small amounts, large supplementation of retinoic acid and similar forms of retinoids should generally be avoided before, during, and after pregnancy, including breastfeeding, just out of simple abundance of caution. So unless specifically advised by a healthcare professional weighing all benefits versus risks as part of a prenatal care, including standard recommended daily allowances under medical supervision, we would often avoid retinoic acid around pregnancy or trying to get pregnant. Then we've got latanoprost. So its mechanism of action, or primary one, is vasodilation, with side effects, most common being localized irritation, although pretty rare. And here again, we've got pregnancy category C. And then you notably want to avoid getting it in the eyes, as most of the known side effects you might see listed are actually around it if it gets in the eyes, including macular edema, iris pigmentation, and significant eye inflammation and discomfort. But prostaglandin analogs such as latanoprost have been shown in studies to significantly improve hair length and density with very few side effects reported, and especially in producing longer, thicker appearing eyelashes. Then we've got melatonin, the famous sleep hormone. So its mechanism of action with hair support is its anti-inflammatory and antioxidant abilities. And then most common side effects, potentially sleepiness, drowsiness, headache, or nausea. So precautions, basically, since it can obviously affect the sleep-wake cycle, you initially want to try when in the evening, for example, when not needing to operate a car or dangerous equipment. Since it is a powerful hormone, it will have many effects in the body. So based on this, it is likely a growth modulator, and it has shown promising results in androgenic alopecia in some studies. Then we've got ketoconazole. So its mechanism of action is anti-inflammatory, antifungal, as well as several other potential mechanisms for supporting hair. Side effects are very rare, but in topical cases would most often be some sort of skin irritation or dryness. Then precautions, pregnancy category C again, precautions in breastfeeding. It is metabolized by the liver and does have quite a few medication interactions, although most of those are going to more likely be with the more systemic routes versus the topical route. But those could include anticoagulants, antacids, antihistamines, or other medications metabolized through the liver. But ketoconazole has a large pool of evidence showing it strongly supports hair growth. While 1% shampoos are available over the counter, higher strengths generally used off-label for hair loss are at 2%. And then other combinations can be made into foams and other compounded formulations as well. Then we've got spironolactone. So it's often preferred over finasteride for female pattern or androgenic alopecia because it's pregnancy category C versus finasteride, which is pregnancy category X. Though women that are pregnant or planning to become pregnant should be advised still to avoid spironolactone out of abundance of caution, but it generally would be considered safer in females based on the category C versus category X compared to finasteride. So its mechanism of action, it's an anti-androgen. It's a 5-alpha reductase inhibitor like finasteride, but it's also an androgen receptor blocker. So the most common side effects are gynecomastia and feminization in males. So for that reason, it's generally going to be avoided to use in men. Then hyperkalemia is another potentially common side effect. So you want to avoid additional potassium supplementation with use of spironolactone. And it is also pregnancy category C. So again, generally recommended in most cases to be avoided around pregnancy or trying to get pregnant, but still a safer option in the female combinations generally than finasteride for the anti-androgen mechanism. Then we've got azelaic acid. So by its antimicrobial and anti-keratinizing effects on the follicular epidermis, it supports a healthy scalp. It has potential for strong support in alopecia areata, as shown by some studies. Most common side effects: dry, burning, redness, peeling skin, photosensitivity. And precautions: it can cause hypopigmentation, but and it does that by decreasing melanin production, but it has been shown to have generally no deep pigmenting activity on normal skin, and this hypopigmentation activity appears to be more so in cases of hypermelanosis. And then this one is pregnancy category B. Then we've got just noting corticosteroids in general. So this could be many different corticosteroids, but a potentially supportive temporarily in hair loss situations related to acute inflammation, such as alopecia areata, where the immune system is involved, and potentially considering some level of suppression of the immune system locally might be of use to avoid damage to hair follicles during that. So what form to use? So some common ones are foams, sprays, gels, and creams. So foams are probably the most preferred and popular topical form for hair loss overall. So it's a liquid phase emulsion that's packaged into a container that mechanically produces a foam with a fluffy, semi-solid type of consistency when dispensed on the skin. So basically gas bubbles are separated from each other by thin sections of a host medium that houses that dissolved drug. So these spread very easily, they absorb and penetrate quickly and without residue, and can cover large surface areas and evenly disperse drug amounts in an often cleaner and more preferred way by patients. So again, foam's probably the most preferred and popular topical form for hair loss because just generally a nicer type of formulation to use. Then we've got sprays, which are water-based spray solutions. So reasonably popular and probably secondary to foams for hair loss applications and popularity. They can leave the hair appearing a bit more wet or greasy, which some patients might not like. And the spray action can be a little harder to control in some cases, sometimes spraying it a little more uncontrollably versus using a foam. Then you got gels, which are like a semi-rigid system in which the movement of the dispersing medium is restricted by like a network of particles or macromolecules in a dispersed phase. So we can all kind of picture what a gel seems like, thinking of like hair gels and such, but generally not as popular again as foams or even sprays in this case because they will force the hair to have more of a wet, greasy appearance. Then we've got creams. So either water and oil or oil and water based soft solid or thick liquid. They can be used but not as preferred for scalp application and not very popular in hair loss compounded applications. Then we've got shampoos, ointments, and oral formulations like tablets, capsules. So shampoos are nice, but they only leave the drugs in place for time of washing hair, so don't typically see much absorption through the skin. An example of this would be prescription strengths of ketoconazole. Then we got ointments, which they're very rarely used in daily hair loss applications because they leave the hair kind of unpresentable. So could be good in cases of injury to the scalp where you really need to protect those injury sites and maybe reduce scarring, but generally not going to be popular for daily, ongoing, long-term because they're not really going to leave the hair in a presentable state, which most patients won't like. Then oral forms, finasteride is an example of a medication proven via this route, although many other ingredients here would not be safe for chronic oral administration and are significantly safer when given topically. For example, minoxidil. But when going into topical formulations, such as the foam, in a case like that, finasteride potentially wouldn't have as many systemic effects like erectile dysfunction, which is not proven, but theoretically could hold true as far as not getting as much systemic impact. So just a clinical consideration there. So some key takeaways for administration. So in general, you don't want to wash or wet the hair for 4 hours after application. And that's just because it can take up to that amount of time for the majority of it to fully absorb through the skin. So you just want to make sure that you don't want to wash any of it off if at all possible. So really better to take a shower, wash your hair, do anything involving wetting the hair before and then after drying the hair, or drying the hair most of the way, applying these applications and letting them stay in. And then basically you would let it dry before applying any other hair care products or hats, or lying your head down on a pillow, for example, or on the bed or couch. So really at that point you just need to let it dry before then you can apply most other hair care products and things, but you don't have to wait nearly as long as you do in like the washing or wetting your hair type of case. And then you just in general don't want to allow the application area to touch others, because just for example, many of these ingredients do have various pregnancy categories. Finasteride generally is not something that should really be used on women in most cases. So if a male were applying a formulation with finasteride, they would generally want to avoid getting that on anything, or on a pillow that a female partner or family member might use, for example. So just keep that in mind. Side effects could potentially cross over, especially to other children or male or female on the other side. So just think about those side effects there and how they might not want to be have those ingredients on their skin. Then for testing and monitoring, in cases like this, there's really nothing more powerful than before and after photos, but we do have to keep in mind it's usually 4 or more months required for visible results. So, and that's because hair normally only grows 1/2 to 1 inch per month, and it can take even longer for some hair depending on what phase the follicles are in, if they're being stimulated by these different mechanisms. So it generally takes at least 4 months with any hair support formula to see significant results. And then side effects to monitor are related to particular ingredients or combinations chosen, but note that the topical formulations often aren't known to cause many of the side effects seen with oral or injectable dosage forms. A key example is minoxidil, which has a cardiovascular black box warning on the commercial oral formulation, but not on the topical formulations, which have even been deemed safe enough for over-the-counter approval. And the majority of common side effects related to compounded hair support formulas and their ingredients will relate to localized skin irritation or sensitivity. Then it's also worth noting that with so many combinations of drugs, drug interactions have to be looked at for various situations. But again, with topical application, many, but not all, listed drug interactions will become clinically insignificant. So it just has to be evaluated on a case-by-case basis. Then here we've got some popular clinic protocols, first in male pattern. So the most common base combination here for male pattern is minoxidil plus finasteride plus retinoic acid. So that gives you multiple primary mechanisms working to support hair health in one formulation, including 5-alpha reductase inhibition, since DHT is often the biggest problem here. Then you've got vasodilation, cellular differentiation and proliferation, and several other potential mechanisms working for you as well. And then you can see the most common types of directions with like 2 to 4 pumps applied to affected areas and massaged in daily. Although those directions aren't necessarily a hard and fast rule, but those are the most common. Then we've got latanoprost, melatonin, ketoconazole, and others that can be added in tested and proven concentrations depending on other aspects of the particular patient case. And just note, you can reach out to your representatives at Revelation Pharma to see what common ranges as far as proven concentrations are for safety and efficacy in these various ingredients. Then we've got popular clinic protocols for female pattern, so which again is androgenic alopecia, and here we primarily remove finasteride and use spironolactone in its place. For example, like in the first formula listed, and even though it's spironolactone is pregnancy category C, that's still safer than pregnancy category X with finasteride. So once again, minoxidil is generally in most formulas, as it's a very proven and safe ingredient for hair support. And then just note that if a female is trying to get pregnant or is pregnant, then nearly all formulations could carry some level of unknown risk and might need to be avoided based on the pregnancy risk categories that were discussed with each possible ingredient. So that's just a matter of discussion between the practitioner and the patient in their particular case and their potential to get pregnant and what the risk there might be. Then finally, we've got popular clinic protocols with alopecia areata. So here again, we've got very popular minoxidil and retinoic acid, so two of the primary mechanisms working there. And then we've also got azelaic acid, which has some good studies for in alopecia areata. And so while these ingredients won't target the root immune system cause in this case with areata, they do support hair follicle health by several mechanisms. But additional medical measures such as corticosteroids or other treatments are often needed to minimize the severity of alopecia areata in most cases. So in summary, with hair loss compounded formulas, we looked at clinical areas for support, potential ingredients and their mechanisms of action, as well as their side effects and precautions, what compounded forms you can use, such as foams, which are very popular. Then administration key takeaways, such as not washing or wetting the hair for 4 hours afterwards. Then testing and monitoring, and potential drug interactions, and then popular clinic protocols. So that concludes this presentation on popular and potential hair loss formulations that can be compounded. So here's how you can connect with us. So sales@revcustomrx.com, or you can connect with us 1-800-547-1399 or at revcustomrx.com. And here you can see our network of pharmacies, as well as other ways to reach us on other social media. So just please, if you have any questions about any formulations or potential things to do, just please reach out to your representative and let us know. We'd be glad to help. Thank you.